Hello, my name is Dr. David Edelstein. I'm a board-certified orthopedist specializing in hand surgery who works at Maimonides Medical Center. I went to medical school at Eldestein College of Medicine. From there, I actually came here to Maimonides Medical Center to do orthopedic training. And subsequent to that, I did a fellowship in hand surgery at Hospital for Joint Diseases. I went into orthopedics initially. It's a very goal-oriented field, so you really notice patient improvement sometimes in a very rapid period of time. And then I sort of followed that up with hand surgery for, I guess, a couple of reasons. One, the anatomy of the hand fascinates me in itself. It's really about getting patients back to function, which I think has always been a goal and something I wanted to do. And the other sort of benefit of hand surgery, you really get to work with the full spectrum of patients in terms of newborns all the way up to patients who are 100 years old. So it's gratifying. Besides the ages, I mean, you have nerve problems, you have skin problems, you have, I guess, problems, newborns, congenital problems, you have fracture problems and tendons. So it really sort of fills the whole spectrum of different types of problems, all located in one body part. And we really individualize the care to the specific patient. Patient's not a disease entity, they're a person, first of all. And we really have a multimodality approach. While I'm a hand surgeon, I mean, we have a hand therapist in the office. We treat patients with splinting, injections, hand therapy, and it's only a small percentage of patients that actually have surgery. Most problems could be remedied, non-surgically. Some patients are sent to me specifically for surgery, but we find that there are ways to treat them without surgery, and they're very happy. And I think the trend now is really, once upon a time, patients, we had to immobilize them for a long time after broken bones or after even complex surgery. Now, because some of the new techniques we have, both surgical and non-surgical, we're trying to get the patients moving much faster, and we're finding that the results are much better, and patients are returning to work much faster. Operating on a newborn could be challenging. I mean, some of the bones aren't formed yet, and the structures are very small. So obviously before we undertake any surgery in a newborn, we make sure with the pediatrician that they're healthy and there are no medical issues. And then I guess the technical part of the surgery, it's difficult at times. We a lot of times use the microscope, so we could see some of these structures. And sometimes it is much different than an adult. But the goal a lot of times is the same. It's to increase long-term function. I don't know if it's one patient, but I do enjoy some of the congenital, surgery on sometimes newborns for congenital deformities. And usually the patients, or really the parents, come to me for what's deemed a cosmetic deformity. And my goal is to give them long-term function. And I'll see them 5 years later, and the parents are happy because the hand looks normal, but I'm happy because the kid's a normal kid and he's doing everything he wanted to do. So those cases are especially gratifying.